Alyson Schwartz from Medica Pharmacy for your health. Good morning, Alyson.
Good morning.
And today, you tell us the topic. Do we want to go jump right into topic?
Sure.
Okay. Didn't know whether you had some opening things we needed to cover for Medica Pharmacy before we.
I have a couple of things that we might mention at the end, but
Okay.
yeah, other than us all trying to eat healthier and lose weight, that's about the only thing new we have going on. Everything else is same stuff we've always offered. We just want more people to know about it.
Okay. Well, as you were telling me about the subject line, my mind always races to things that maybe make more sense to me. And I'm thinking that this item that we're going to talk about today, this organ, this thing that we're talking about today, is kind of comparable in my mind to the new computers that run everything in a car. Today we're going to talk about the thyroid, and you said it basically does it's kind of like our energy or our engine management system for our body.
Exactly. Yeah, it's like your car in idle.
Yeah.
You know, sometimes your car idles too low and sometimes it idles too high, and usually when it's not idling correctly, then there's another issue going on in the body. Right.
That's it. And that's the old thyroid. Where is it?
It's in your neck, actually. Yep, it's in the front of the neck. If you're a male, it's underneath your Adam's apple. So for anybody who's ever been to the doctor and they kind of palpate your neck and then they tell you to swallow, that's to see is your thyroid gland enlarged.
Okay.
So that's what that test is for.
All right.
So yeah, it's in your neck. It regulates the metabolism in every cell of your body. So it affects growth and pretty much any function that your body does. When we talk about thyroid hormone, it's important to understand that there are two thyroid hormones that are very important. One is T4. The other one is T3. The reason that's important is that we don't always test for both of those on a thyroid panel test. And when we talk about diagnosing thyroid issues, I'll mention that again. 27 million Americans approximately have some type of thyroid disorder. It is more prominent in women than it is in men. That's somehow related to estrogen and progesterone levels, we think, and stress. I'm not saying women have more stress than men, but especially women that are raising children and trying to work a job or whatever, somehow we end up being more stressed. And us women, we like to cry and throw temper tantrums and stuff more than men. Well, maybe that's just me. I'm not sure. That might just me. I might be alone in that one.
I mean, women have to put up with men, and I'm not trying to be funny, but
I wasn't going to bring that up.
Well, no. Well, I was.
And it's true. We joke with some of our women patients that are coming in to get stuff for their sick husbands or sick boyfriends, and almost every one of them are like, oh my gosh, there's nothing worse than a sick man. No offense, guys. So, but I know that there are many men that are there are lots of women that are poor patients, but I sure know an awful lot of men that are poor patients as well, and it's always mostly their wives or girlfriends coming in to get their stuff for them. So, oh goodness. Well, anyway, back to thyroid before I start to upset all the guys out there. The thyroid regulates temperature, your immune response, and your stress response. However, since it regulates so much stuff, if you have a lot of insults, so if you've got an elevated temperature, if you're sick or you're under a lot of stress, that can actually burn your thyroid out. So it's helping your body deal with all these different intruders to the system, but it can only handle so much. Like anything, your body can only take so many toxins and so many stressors in it. So sometimes it will not function correctly, and it gets kind of worn down or fatigued. So it also, we have a lot of people that, they'll come in and maybe they're tired or they're worn out and they have these symptoms and they'll say, and I'm getting swelling in my ankles. That can be a sign of thyroid disorder because your thyroid is responsible for assembling your water molecules in your body to deliver them to the correct locations. So if it's not working right, that fluid actually leaks out of your cells and it accumulates under your skin, and so you get swelling. We've even had people that actually say, my tongue feels swollen. So that, I'm not saying run to your doctor if that's the case, but if your tongue is swollen, it could be some various number of things, allergic reactions or anything, but it sometimes can be related to your thyroid hormone. It also helps to helps the insulin in your body to push that sugar into your cells. So if your thyroid is not working correctly, sometimes you need larger amounts of insulin to push that sugar into your cells. Well, that can then lead to insulin resistance, which can then lead to weight gain, which then can lead to diabetes. So that's a vicious cycle that would need to be addressed. So, I'd said something about your car could either idle high or idle low. So your thyroid can either be overactive, which is hyperthyroid, or underactive, which is hypothyroid. There are ways to correct both, but there's also symptoms that are a little bit different. So if your thyroid is overactive, typically it's like you're in overdrive. Your metabolism is going faster than it should, and your thyroid's producing more hormone than you need. So you might be warm, your skin might be moist. Occasionally men can have an enlarged breast so that it's called gynecomastia, but sometimes you'll have an enlargement of your breast that's more prominent in men with thyroid. Sometimes your nails will lift from the bed. So, if you look at those nails aren't sitting quite down in your bed, sometimes that's a sign of hyperthyroid. You might have a goiter, which is that enlarged thyroid that you can feel upon palpitation. Maybe your heart rate's too fast. You might be losing weight or unable to put weight on. Maybe you're nervous or anxious, and sometimes your eyes will bulge out. So sometimes you see those people that have those big kind of bug eyes. Yeah. That can be related to a high thyroid. And you might be intolerant to heat. So you just, can't stand to be out in the heat because when your metabolism increases, your body produces more heat. So then if it's hypothyroidism or you're not producing enough thyroid or you're producing plenty of thyroid, your body's just not using it correctly. So because there is a hypothyroid where your thyroid's actually low, and then there's also a thyroid where your thyroid hormone is perfectly fine, but the other factors of your body are affecting how your thyroid hormone binds to the receptors. And then you think you're low thyroid, we just need to fix the other condition of why is your thyroid hormone not binding. So as you age, you're more likely to have low thyroid. So particularly around 40 to 45 years of age is when you start to see a decrease. If you're under a lot of stress, have any kind of heavy metal toxicity, or if you have poor nutrition, and I talk a lot about the extreme poor nutrition of the United States, which I think is one of the reasons why we have so many people with low thyroid is we have a horrible diet. And your body cannot function correctly on a horrible diet. If you have low thyroid, typically we think of dry skin, dry hair, dry eyes, brittle hair, brittle nails, so your nails tend to snap off. You're intolerant to cold, so you're just cold all the time. You always dressing to be warmer. Again, because your metabolism slows down and you're not burning all those calories, and so you tend to be colder. Because everything slows down, you tend to have more issues with constipation. Sometimes you have puffiness under your eyes. That has to do with the water getting to where it needs to go. You might be depressed. You might have a hoarse voice, and you're tired. You just tend to be tired, on a regular basis. So all of these symptoms are kind of nonspecific. So yes, they can mean you have thyroid issues, but they can also mean that you have something else going on. So it's real important that you talk to your doctor about getting the thyroid test function. And most doctors do a thyroid test function. What they test for most of the time when we see labs is they test for TSH, which is your thyroid stimulating hormone. That hormone tells your body to produce more thyroid. The other one we typically test for is T4. Most of the commercially available thyroid products, Synthroid and Levoxyl, are the two most common, or they're both levothyroxine. That's T4. Now, the problem comes in with that is that the active thyroid in your body is T3.
That's what I say. I'd written that down, and you hadn't mentioned that yet.
Right. So now we're going to get to that one. So we test for TSH, which is a huge range. It's like 0.5 to 5.5. And as long as you're somewhere in there, you're typically told that you're normal. I don't necessarily feel that if the lower end of normal is 0.5 and you're a 0.6, that maybe that doesn't mean there's still an issue. But sometimes that TSH is perfectly in the middle, and your T4 might look perfectly fine. But you may not be converting T4 to T3. You have to convert it in your body. And if you have stressors and toxicities or something's wrong with your immune system, and other hormones are messed up, for example, cortisol, if your cortisol level, which is the hormone that you produce when you're stressed, and it gets really high until you wear yourself out and then you don't make enough of it. So either too high or too low cortisol will affect your thyroid. And then high estrogen levels affects your thyroids. And because we're bombarded with estrogen, and unless you're buying hormone-free foods and steroid-free chickens and meats, then you are getting estrogen in the foods that you eat. Then when your estrogen levels are high, which we see most commonly, the vast majority of anybody who has a little bit overweight issue, their estrogens are typically too high. Estrogen turns your thyroid hormone down. So you might have all the thyroid hormone that you need, which I mentioned earlier, but if your estrogen levels are too high and your progesterone levels are too low, your thyroid hormones cannot attach to the receptors, and so your levels will look fine all day long, but you're actually low thyroid because it doesn't work right.
Yeah, they're just not doing their job.
Exactly. So you have to be able to convert the T4 to the T3 and hope that all your other hormones are in balance so that it works right. But some people also produce a hormone called reverse T3 that actually converts T3 back to T4. then you also might produce something that's an antibody to your thyroid that eats up your T3. So when you're going to your physician to check your thyroid, they're going to get a TSH, I promise you, and they're probably going to get a T4. But I highly encourage you to ask your physicians to test for T3 at bare minimum. And if your insurance will pay for it, or if you're willing to pay for it if your insurance won't, go on and get the reverse T3 and the thyroid antibodies. That is the full thyroid workup. And if you're not doing a full workup, you might be missing something. Mm-hmm. And, I oftentimes we oftentimes treat symptoms that don't fix the problem. So if we're not doing a full workup, we might be missing something. And maybe we don't need a thyroid medication. Maybe we need to fix that underlying issue. Is it, cortisol levels out of whack? Is your estrogen too high? Are you creating antibodies to your thyroid? And we need to figure out why are you doing that. So there's a lot of issues that go into diagnosing a thyroid disorder. And I just want, start asking to get the entire profile checked.
What do we damage our thyroid gland by doing things or not doing things, and what can we do to try to keep it healthy? Just stay healthy ourselves.
Well, it is, good diet and lowering stress. We talk about that management of stress a lot. And, I remember it's been a while back, I think, but I talked about even just taking that 2 minutes of the, www.donothingfor2minutes.com. Close your eyes, take a few deep breaths, try to just lower that stress around you and refocus it on what you're doing can make a huge difference in your energy level. But just those few minutes of making yourself relax can affect every organ of your body and your thyroid. There are some different things you can do to treat thyroid. Obviously, there's medication, but if you are just kind of borderline, or maybe you feel like this might be you, but your test is normal and they don't think that that's what it is, for your thyroid to work properly, you have to have specific vitamins and minerals. And the ones that affect thyroid most commonly are selenium, chromium, zinc, iodine. And you do iodine to prevent the goiter and the overgrowth, which is why we have iodized salt. Mm-hmm. You don't have to eat iodized salt. There's lots of iodine in the environment. So as long as you're getting a good source of iodine, it's good enough. Iron, but in the source of ferrous glycinate, not ferrous sulfate or gluconate, which is the two that's most commonly seen. So you want to make sure that if your iron's a little bit low, you want to make sure you're on the correct iron supplement to be absorbed correctly. Copper, vitamin A, vitamin D, vitamin E, B2, B6, and B12. Okay, so now I don't want anybody...
It's like a multivitamin to me.
Exactly. And, it's funny because you have so many people that come in and they're like, my doctor said I need to be on B1 and B6 and B12. So don't buy all three. Just get yourself a really good quality B complex. Now, if you don't have proper lining of good bacteria in your digestive tract, you for sure won't absorb your B vitamins, but you're not going to absorb some of this other stuff as well. So all vitamins, I've talked many times, are not created equal, and a lot of multivitamins do not have, the proper amount of vitamins in there, and they don't have the mineral aspects to them to get the right amount of selenium and chromium and zinc and all these other things. So you want to make sure you've got a good product. And most of those good products are not in a one-a-day formulation because they pack. When you see that little bitty pill that's supposed to have all that stuff in it, there is no way you're going to absorb that. And so we actually recommend the clinical nutrients for men and women from Integrative Therapeutics. It is a physician line of vitamins specifically for healthcare providers to recommend. It is not designed to take once a day. It is designed to take 3 times a day with a meal. The great thing about the clinical nutrients is I have very few people that I have not had come back to me in 2 to 3 weeks and say, wow, what a difference I feel with this supplement. And the wonderful thing about that company is if you go buy Women's One A Day or Centrum or any off-the-brand vitamin and you don't like it, well, that's too bad. The great thing about clinical nutrients is that company stands behind their product. And if you take it like you're supposed to take it and in 30 days you don't like it, they will refund your money. So, it is not a $5 vitamin. So, I had somebody ask me once, what's a really good cheap multivitamin? There is no such thing. So don't waste $5 or $6 or $7 on a cheap multivitamin. That's basically a waste of your money. If you really want a good multivitamin, unfortunately, you do have to pay for it. But they stand behind their product, and they will refund your money if you do not like it. Yeah. So that's the one good thing about them. I talked a little about the increases in estrogen and progesterone, or decreases of progesterone, increases of estrogen, and then your fluctuating cortisol levels that will affect your thyroid gland. So if you deal with your stress, if you're under a lot of stress, do a good adrenal stress supplement. get your hormones balanced. You can do that naturally with a couple of over-the-counter products that help your body to metabolize your hormones correctly. One of them is called Endoplex. It makes sure that when you're under stress, you typically produce high levels of testosterone, which convert to your estradiol or your estrogens, which lead to ovarian cysts, prostate problems, breast cancers, and overall inflammation in the body, and a lot of times acne, specifically on your chin. So the Endoplex tries to take those stress hormones to make sure that you're balancing all your hormones naturally and you metabolize them the way you should instead of having too much of one that just keeps growing and growing. So that's an option for that. Cut out the gluten. I know we talked a little bit about gluten-free diet, but it creates a lot of inflammation, and they somehow, and I don't have the specifics on this, I can try to get some more information if anybody has specific questions, but they say that if you cut out gluten for about 60 days, that some people have been able to come off their thyroid medication because their thyroid starts to function more normally after getting all the gluten products out of their diet. Now, please don't go out and buy a bunch of stuff in boxes that say gluten-free. I'm not a fan of organic cereals or gluten-free boxes of kids' treats or kids' snacks. Fresh foods. Stay away from anything in boxes or packages and with nutrition labels, and eat fresh foods, but stay away from wheat products and bread products specifically. Organic food, because you don't get all the toxins and the hormones in organic food, and that helps to maintain more stable blood sugar. And then when you exercise, you actually increase sensitivity to your thyroid hormones, because anytime you exercise, you increase metabolism as well. So proper exercise, a good omega-3 fatty acid, that's great for inflammation, and we usually recommend Eskimo 3. And then a good probiotic. So you got to have the right digestive lining in your gut to absorb all the vitamins and minerals you need for proper thyroid function.
Very, very complicated. That's why Medica Pharmacy has you guys over there to do basically, I'll call it a one-on-one.
You're right, and since we've been working with the integrative therapeutic line of supplements, the lady that is kind of the specialist, she actually trains most of the physicians in the Louisville area on these supplementations. She is a gem and a wealth of information, and she's been doing this for 25 years now, and she actually assisted us with developing a consultation form, and it goes through, it's I think about 5 pages long, so it's pretty intense, and it asks you a lot of questions about a little bit of everything. But then we'll go through it, and the great thing about her is I can then say, if I feel like I'm missing something, is I can email her and say, okay, this is the story, these are the main symptoms, this is what I think, and she'll, say yes, but maybe you might think about this. So we're learning a lot from her, but it's taken the time to really delve into, why are you tired? Do you sleep? Do you always wake up at 2 o'clock? Are you waking up because you need to go to the bathroom? Are you waking up because you've been under stress and you've messed your cortisol level up? So it's pretty neat stuff, and we just have really gotten into that more specifically here over probably the past 30 days or so. But I've used that consultation form a lot lately, and it's shown some pretty interesting things of things. I'm amazed at the amount of people that come in, and I know my last radio show we talked about digestion and stomach acid, and I've been amazed at the amount of people that have come in with constipation issues that we've got them to do the vitamin C and magnesium, and I mean the next day they call me and they say, wow, this is great. I mean, it's working, and they keep coming in and buying it because now they're not constipated and they're not having the bloating and the discomfort that's associated with that. So just little things of fixing the nutritional statuses in our body can make a big difference in the way we feel.
As long as we have the right information.
Exactly. Yeah. Exactly. One thing I wanted to mention real quick, you asked about kind of new things. Yeah. It's still really hot. And
really?
It's just really hot out there. Yeah. And we have like our own Garrett Ingesett there at the pharmacy. He's a big tennis player, and I actually went to watch him play one Sunday, and it was like 100 degrees, and I thought, why are we playing tennis in the middle of the sun on such a hot day? This is insane. But I mean, I ride my horses but I try to ride early. But you're still, if you're a big person to play tennis or ride a bike or run, or we're all pretty much still going to do it if you're really into it. So it's important to hydrate your body, and it's. So many people go to the Gatorades and the Powerades, and so we were looking for some good alternatives to that. And, the homeopathic line of stuff we have been selling has been going gangbusters. They actually have some hydration products that help to keep you from getting dehydrated and fatigued in this heat. So they have a supplement called Hydrate, which is a liquid that you put some drops of that liquid mixed in a mixture of like a little bit of juice to mostly water. I think it's 3 parts water to 1 part juice. And they say if you start that 2 to 3 days before you have a competition or a marathon or whatever big activity, and you continue it for a couple days after, it can greatly reduce the muscle fatigue and the dehydration on your body. You can use it regularly. They have it to where if you're just going all the time, you can actually use it so much for the first week or two, and then you decrease the amount that you use. And then we also have something called nitro powder, which is a trace mineral supplement, and it's a grape flavor. Doesn't have all the sugars of the Gatorade and Powerade, and you just mix the scoop in with your water that you would take out with you, and you drink it. They say it's really great. I have one of my good friends that has done the Ironman in Louisville the past few years, so I got some of it for her to use this year. And then we have a couple other guinea pigs that are going to try it, but they say they've had great results with it. So if you're looking for something, if you've got any marathons or big competitions coming up and you want to, help to support your body to not get that, muscle cramps and fatigue and all the other issues you get in this kind of heat, then it might be something worth checking out.
And that you said that one of them you actually started. If you were doing a big event on a Saturday, you could start it before, so
right.
you're getting kind of a build up.
Exactly.
Yeah.
So you're preparing your body to deal with the stressor of the heat and the activity you're going to be doing, and then you continue it for a couple days later to help your body recover.
Okay. And you still have the rewards program for people.
We do. We have the VIP program. So if you do not have, you come in Medica Pharmacy and you do not have a VIP card, I know my crew is supposed to be asking you guys when you come in. There are times I know we get busy and sometimes they forget. So if you don't have a VIP card, please make sure to ask about yours when you come in. And so you do get points for prescriptions or over-the-counters or anything that you get. And I don't remember the exact specifics, but you'll get like $10 coupons in the mail that you can use towards stuff in the pharmacy.
Yep. And all you have to do is ask.
Exactly.
At Medica Pharmacy.
Exactly.
Well, Alyson, thank you very much. And as you did say, it is hot. I think we may get some break in it, but no matter the season, if we are healthy, we'll handle hotter weather better. We'll handle cold weather better if overall we're healthy.
Exactly. Your body is an amazing thing, and if you feed it right and treat it right, it can handle most anything you throw at it. And
disease and illnesses that will come our way that we just simply can't avoid in most cases. Oh,
exactly. Yeah, the healthier your body is, the better you can fight off the different things. Kids are getting ready to go back to school here soon, and that's 70% of your immune system is in your digestive tract. So if you got kids that have either diarrhea or constipation or not having regular bowel movements, I know that with my little one, if he's on a probiotic, it greatly decreases the amount of time that, he is sick when he does get sick. So, put them on a good supplement, put them on a probiotic. There's a few things to kind of ward off illnesses. So there's a great product called ViraClear that there's a Dr. Wendy Daly in Louisville, pediatrician, that this ViraClear substance she has been using with kids with mono. And, most of us know mono, just knocks you out and you're out for a few weeks. Mm-hmm. She has her kids back in school in 3 days by using this ViraClear. So the minute they get symptomatic, any kind of, fatigue or fever, she starts them on the ViraClear, and she's having them back in school in a couple of 2 to 3 days and symptom-free from mono in about 7 days. So she's seeing great results with that. It's a natural product, safe for kids 2 years old and up. I know that I got a sore throat after my little one got sick not too long ago. I took the ViraClear, and by the second day, I had no symptoms. So I took it that first day, and by the next morning, my sore throat was gone, and I felt fine. So was it a fluke? I don't know, but I know that she recommends it a lot. We sell a decent amount of it. And I don't know if we still have, and we did have some that were a little bit short dated, so we had a buy one, get one free on it. Mm-hmm. So if it's something you got kids going back to school and you might want to have some ViraClear on hand in case they get a little bit of a runny nose or cough or a sore throat, I think we still have some buy one, get one free, and I'll double check on that when I get back.
All right. Thank you very much for stopping by today.
All right, thank you.
Our guest, as always, for your health, brought to you by Medica Pharmacy, is Alyson Schwartz from Medica Pharmacy. That's our show today. Have a great one, and stay tuned. I think we've got another show coming right around the corner.